had always planned to come back to Ghana to work at some point.
You can take people who have never seen a certain technology and you can do it. And it's this end of the parenthesis. Everybody deserves the right to good health care.
For me, bringing my practice to Ghana has been a blessing.
Here I am at LuccaHealth, which is a medical specialty centre here in Accra, and they are taking healthcare in Ghana to the next level. So we're going to have a tour around, meet some of the people that work inside, the physicians, as well as the other staff. Let's get going. When you arrive at the facility, you'll just take a lift up to the first floor, and then you'll be met by our friend here who's giving us hand sanitizer and making sure that we don't have COVID. And then we come through to the reception area here. Really nice big reception, clean, air conditioning. What more could you want? Different health insurances that they accept. There's BUPA, which is in the UK, and global different insurances there, which is really helpful. So if you have an insurance outside of Ghana, then you can use it here, and they also have some that are also inside Ghana that can be used here as well.
So my name is Linda Avaji. I'm the Director of Ambulatory Services for LuccaHealth. So beyond operations, I look at the day-to-day operations and figure out how we can better serve our patients and customer service. So it's end-to-end. So before you come in the door, how the phone is answered, all the way through when you go home and you're discharged, how you feel about LuccaHealth when you leave. That's what I'm in charge of.
And were you born and raised in Ghana? Or
No, so I was born in Ghana, but I was raised in the United States. I left Ghana very early. I did all my schooling in the United States.
Cool.
I went to Morgan State University, and then I continued my education at Johns Hopkins University for my MBA, and then I'm here.
Did you come here for LuccaHealth, or were you coming back anyway?
I've always wanted to come back, but I did come back for LuccaHealth. I've always wanted to come back to Ghana and contribute more specifically in healthcare.
Can we see inside?
Sure, sure. So most of our exam rooms look sort of like this. So we have the exam beds, and then the exam beds along with our diagnostic sets. We also have mobile carts with the diagnostic sets on it, so you get your vital blood pressure, your pulse ox, I don't want to use technical terms, but you get your vitals checked.
Yeah.
And then you have a conversation with the physician right from here. Most of the rooms, again, there's not a lot of machinery in the basic conversation with the physician. ENT. So here's where the ENT works. So we call it a spaceship because it has everything. So here we have also very high focus on infection prevention. So we do a lot of sterilization. As you can see, the building is very clean. We make sure that we maintain a certain clean standard and infection prevention control. The theater procedures are performed at our other location. Yeah, so the operating theater is at our second location.
So what is the main surgeries that you do here? What do people mainly come here for?
The purpose of LuccaHealth is to fill the gap for particular specialties because there was either a long wait or the resources for a particular specialty weren't there. So the specialists that we have here, so this is general surgery, gynecology, urology, nephrology, ENT, and then internal medicine.
So I am Dr. Udell Tagoe. I'm a general gynecologist and minimally invasive gynecologic surgeon, and I'm also the medical director at LuccaHealth.
So what made you decide to work here at LuccaHealth?
So I am from the US, first generation. My parents are Ghanaian, and I had always planned to come back to Ghana to work at some point. But the opportunity arose. Actually, my best friend informed me that she saw this job opening here at LuccaHealth. And so initially when I considered it, I hadn't, because it wasn't on my radar to come to Ghana so soon, I didn't really pursue it. But then as I thought about it and thought about the benefits that there would be to get involved in a project like LuccaHealth, and also the benefits it would be for my family, my children, I figured, why not take the leap?
So have you got kids that you moved over to Ghana as well?
Yes, I have 4 children.
Wow.
And so I packed them all up and we all came over.
What age range are your kids?
My eldest is 10 and a half and my youngest is 6.
And are they enjoying it?
They are.
Oh, that's great.
The thing about it is because I'm first generation American, but I've always come to Ghana during childhood for visits to family and friends. And my children, the same. My husband was born and raised in Ghana. And so they've always come here since infancy to see my husband's parents. They've always lived here in Ghana. So they've been coming here. So now that we live here, it wasn't too much of a transition. Obviously, yeah, it wasn't too much of a cultural shock because they're familiar in the first place. So it's worked out well.
Oh, that's great. And what is the idea behind LuccaHealth?
So LuccaHealth is a multi-specialty medical and surgery center, and we actually specialize in ambulatory care or outpatient services. So what that means is multi-specialty. We have many different specialists that are housed under one roof. We actually are here every day, Monday through Friday, 8 through 5, and we don't rotate to different facilities. So it means that, obviously me, gynecologist, general surgeon, internal medicine / nephrologist, urologist, ENT, and then soon to be cardiology will be joining us. We all stay here every day. So if there is coordination of care, meaning someone comes to me for a gynecologic visit, but I realize maybe they have some other medical problems, let's say hypertension or diabetes or something else that needs to be managed by another specialist, I can just coordinate and get that consultation arranged same day, usually, very seamlessly. As an ambulatory center specializing in outpatient services, it means that most of what we do from consultation through surgery is done on an outpatient basis.
And how do you find your staff for this facility?
So, same way I was found.
Oh, right, yeah.
There was an advertisement that, like I said, my best friend saw. So a lot of medical journals, they usually have ads, just like a newspaper, there's ads in the back with job postings,
right.
et cetera. So we usually do that. We also have recruiters that we work with internationally to, advertise for the position. And not just outside of Ghana, but within Ghana as well. So we do have representation from the US, from Europe, from Ghana, both in the physician services and with nursing as well.
What is healthcare like outside of LuccaHealth in Ghana? Is there any shortcomings and that's why LuccaHealth felt that it was needed? Or, if I just went to a local hospital, is it going to be like this or is it going to be totally different, basically?
So wherever you go, depending on whether you're in the public sector or the private sector, and when I say wherever you go, I mean not just Ghana, but internationally, you will have a different experience. I think the thing that's different about LuccaHealth in particular is the focus on outpatient services and on minimally invasive surgery. So I did mention what outpatient services, what that means. But in particular, minimally invasive surgery, also known as minimal access surgery, also known as laparoscopy, is a method to perform surgery where you don't necessarily make a big incision on the abdomen. So if you think of a cesarean section, for example, for me, I'm OBGYN, so that's the easiest thing that comes to mind. You think of a cesarean section, you get a big, sometimes hip-to-hip incision on the abdomen. And typically, when you have a cut like that done, not only for a cesarean section, but maybe for a hysterectomy, where you remove the uterus for various reasons, or even fibroid surgery, where you're removing fibroids, leaving the uterus in, but you do a big incision for that. Historically, that's how most surgeries, at least when it comes to gynecology, have been performed. Same thing with general surgeries, like gallbladder removal, appendix removal, if you have appendicitis. Many times you wind up having a rather large or sizable incision on the abdomen. And that usually means more pain. You may have to stay in the hospital for longer, sometimes up to a week. And then also other increased risk of certain complications like bleeding, infection, etc. But the general surgical world has realized, and this is worldwide, that if you can do the same surgeries with smaller cuts, then the risk of certain complications is less. The level of pain is less. The recovery rate is faster. And so over the years, as this has been introduced, and championed by certain surgical pioneers, we realized that there's a huge benefit to the patient in terms of trying to shift more towards minimal access surgery.
What's your name and what is your role here?
Sure. My name is Fatima Kombati. I'm a general surgeon at LuccaHealth. So that means I do a lot of elective and acute care. General surgery basically is a catch-all field, as the term says. Specifically though, here at LuccaHealth, I do a lot of breast cancer. We do that in ways that are traditional and more modern. What I mean by that is we offer mastectomies, which means removal of the entire breast for cancer, but we also do breast conserving technique. So that means that women have choices, and we can definitely do that in Ghana. I do a lot of abdominal work, and we tend to do that in minimally invasive ways, meaning with small cuts.
And what made you decide to come and work here in Ghana, or were you living here before?
It's a great question. Do you have time?
Yeah, sure.
So a little bit of destiny. When I was 19, I was a Volta Hall girl at the University of Legon.
All right.
So, and I loved it. It was an exchange program from University of California at Berkeley, and I loved it.
Cool.
Say that again. I loved it. Then I did a rotation at Corlebu as a med student, and I loved it. I was in East Africa about 10 years ago, so this is in my lifeblood.
Oh,
so when I
okay.
saw that they were building an ambulatory surgery center in West Africa, I didn't know the country. I applied. And then when it came to be Ghana, I thought, of course, I'm coming. So this is my third time living in Ghana.
Yeah.
Third time
nice.
is the charm.
And what do you like about living in Ghana?
You have time? I thoroughly enjoy, especially with this job, I thoroughly enjoy, and I call it the parentheses, right? You have some conditions which are very still stuck in time, okay, for lack of a better word. And for the medical aspect, you can take people who have never seen a certain technology and you can do it. And it's this end of the parenthesis. Everybody deserves the right to good health care. That's where I started. So when you do this end of healthcare, people who haven't seen it, the appreciation is just so much more genuine. I love that.
Oh, yeah, that
Yeah,
sounds
and I
really
think when you
nice.
grow in your field and you have passion for what you do, that, appreciation, that's the honest truth of why I'm here.
Oh, perfect. Thanks so much.
Hi, my name is Sherry Massey, and I am an anesthetist here and also Chief Nursing Officer as well.
And where were you before you were working here? Were you
Right.
living in Ghana or?
No, so I moved to Ghana from Houston, Texas, 2019, sorry, last year.
Okay.
Yeah, so I've been here for about a year and 8 months.
And what do you like about LuccaHealth and working here?
So working LuccaHealth has been great because it is like bringing my practice in America to Ghana. So I'm originally from Cameroon.
Oh, cool.
Yes, and I have been wanting to come back home, home meaning the continent home. So for me, bringing my practice to Ghana has been a blessing because I have had to train people and also expose, what we do in America here, bring all the technology that all the knowledge that I've learned in America here as well. So basically what I do as anesthesia is I take care of patients, I provide anesthesia during surgery, and then I send them home same day. Now we don't have that here in Africa as much as we do that in America. So that's a constant practice in America where people go home same day after surgery. But here it's different.
Oh.
People stay in the hospital for maybe a week or two after surgery. And you don't necessarily have to, yes, because one, you get more infections when you stay in the hospital. It's high risk for hospital-acquired infections. And two, you go home earlier, you're around with your family and friends, so you recover faster as well. And when you're up and ambulating after surgery quicker, your recovery is quicker. So these are all the things that we're bringing, from the States to Ghana, and I'm very excited.
Yeah, I really love that
Yes.
people are moving here to bring their expertise, just as you
Right.
say.
That's right.
So if somebody wanted to come here, they had an ailment that they wanted sorted out, how does the payment work and what insurances do you accept?
Sure. So if you're interested in coming to LuccaHealth, when you call and book your appointment, we go through the process with you, what exactly that you're looking for, put you with the right physician. Again, because we're multiple specialties in one place, we have to make sure that you're seeing the right doctor. Once you finish, we do accept cash, and all other forms of cash payment. So is POS, we do mobile money, but we also do accept insurance, as you said. So for local insurances, we accept Glyco. Most of the Glyco products we accept, and we also accept Acacia medical insurance as well. We accept a number of international insurances all over. So we accept GeoBlue, Henna, Bupa, Aetna, United Healthcare. It's quite a number. So if you visit our website, you'll definitely see the list of international insurance that we accept. And of course, if you have any questions, you can give us a call and we'll walk you through what plan that you have and whether or not they can accept.
Thanks so much for watching this video. If you're interested in this healthcare facility, check it out in the description below, and don't forget to subscribe to my channel.